This morning, we're learning more about the toll this pandemic has taken on our mental health. A CDC report found that 3 times as many American adults reported having anxiety compared to last year, and 4 times as many reported feelings of depression. The number of people seeking help has spiked too. We are in the throes of a pandemic and now a mental health crisis. So what are we going to do? Let's bring in Mental Health America President and CEO, Paul Gianfrido. Paul, what systemic changes can be made at this moment for all these people who are struggling?
Well, there's a lot of systemic changes that can and should be made. First of all, it's good news that the members of Congress agreed to put $4.5 billion into this stimulus plan for mental health, which is far more than they put in so far. Additionally, there was good news last week when most of the major advocacy organizations in the United States banded together and said we have to focus on a new way of thinking about mental health and mitigation of mental illness, starting with prevention and early intervention. And this unified vision, I think, could move people forward a great deal in 2021.
Is telehealth a game changer? We are isolated, but we can connect in other ways.
Oh, telehealth is a help. It's a way to bring more resources out to people in areas that have been poorly served with mental health services in the past. But it's not the only solution that we've got. It's just one more tool in the tool chest. And certified peer specialists are another one of those tools in the tool chest that could really bring mental health services out to a lot more people in the coming weeks and months.
What has this pandemic done to our healers, our healthcare workers who've been on the front lines day in and day out? Are you worried that the toll it's taking on them goes far beyond just job burnout?
Absolutely. They've been taking it on the chin here, and we have been doing our part to keep ourselves healthy so that we don't hit the system there. But we've done a recent survey of healthcare workers this fall and just released the results a couple of weeks ago. And what we found is, most troubling, about half of healthcare workers across the board are thinking they may be in the wrong profession right now. If we lose a substantial percentage of those, we're not only going to not get the healthcare we need moving forward, we're not going to be able to get the kinds of services and supports across the board that we need moving forward.
We already had a healthcare worker shortage before this pandemic. What do we need to do for our kids, for our teens right now? Some who are losing a year of academics because virtual learning doesn't work for them. But what is this doing to them mentally? A year without social interaction, without physical activity with their friends?
Yeah, it's doing a lot of harm. Really, the whole approach that we've taken to this pandemic has done harm. Again, in our survey, we data from our mental health screening program that we have online that is free and available, we're seeing that more than half of the 11 to 17-year-olds are having suicidal or self-harm thinking on more than half the days of the week. And so we've got to be willing to understand that mental health issues are focused and concentrated primarily in our kids. And yet our public policy has really looked more toward later stage crisis interventions for people, what I call stage 4 activities, not recognizing that with mental health conditions like every other chronic disease, we've got to start before stage 4. We have to start with stage 1. We have to start with prevention and early identification and intervention. And that starts with our kids in schools, whether or not they are there in hybrid models and remote models or in-person learning. They're all suffering, and we need to take care of this.
People are lonely. People are suffering. It's always difficult during the holidays, especially this year. If you can help a friend, a neighbor, reach out. Paul, thank you so much. And if you know anyone who is seriously struggling, know that there is help out there. Call the National Suicide Prevention Lifeline at 1-800-273-8255. You matter. We care about you every day.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.